Good evening. Welcome to this month's Town Administrator's Report. I'm David Watts Jr. With me is our Town Administrator, Steve Mayo. Steve, welcome.
Thank you, David. Thank you for hosting us again today.
We're going to make a departure from what we had said last month we were going to talk about. We're going to set town meeting aside and we're going to look at the current coronavirus or COVID-19 pandemic that's going on around the world and in the United States, and especially, Steve, from the Wakefield point of view.
Yes, because we are going to talk with the Wakefield point of view, we have a panel. We usually don't have a panel, but I would point out to those at home that we are more than 6 feet apart. We are practicing social distancing, which you should all be doing, by the way. And with us is Ed Dombrowski, the chairman of the town council. We have Tom Walsh, our emergency management director, and Ruth Clay, our health agent for the town of Wakefield. And I got to say, what a great team they have been in helping guiding us through this situation, as have been our town employees. And we'll have a lot more to say about some early steps that we took together to try to keep Wakefield as safe as we could during this period, trying to limit the spread of this contagion. Mm-hmm. So I think we are a little bit ahead of the curve, and I'll tell you that many people have spent many hours, and all for the safety of the people of Wakefield. So thank you, and I'll chime in when it's important.
We're going to go to Ruth first as our health department director. And Ruth, what right now is the status of COVID-19 in Wakefield, and what are we looking at over the next few weeks?
Well, as of now, we have no confirmed positives of COVID-19 in Wakefield. We have a number of people who are self-isolating, and we do follow them. Our public health nurse, Karen Cronin, gets information about contacts that we follow, and that's what she does. We talk to them over the phone. We explain what they should be doing, and continue to follow them through the 14 days.
And what should the average person be doing who is not under in-home or self?
Edit that.
Yeah. What should people be doing?
So I believe that I think government's been doing a good job at getting the word out about washing hands, coughing into your sleeve, and most importantly at this time, social distancing. It's just so important that people stay at least 6 feet away from each other. And the reason that's so important is as every day we're learning more information about this disease and this virus, and we're learning how it can be spread when people have no symptoms, mm-hmm. so they don't know that they have it. If and when it passes on to other people, which it does, if one of those people that gets passed on to is an older person or a person with an underlying health condition, the consequences can be devastating. And that's important for two reasons. The obvious reason is we don't want anybody with major health problems. We also need to be mindful of our healthcare system. Our healthcare system is not built for pandemics. It's built to operate on a normal basis, and even then a lot of hospitals have a very difficult time breaking even, as we know. So it's unreasonable to expect that they have 100 ventilators waiting in the basement for this kind of scenario. It's just not practical or reasonable. So the reason we're doing all this is to minimize the number of people who are going to get very ill and need help with breathing. Most people won't know they're sick, or they'll be mildly sick, and they'll stay home and take care of themselves with cough syrup and Tylenol and your basic flu medications and get well. They're not going to be going to doctor's offices, and they're not going to be going to emergency rooms. It's only going to be people who are really sick, who are having respiratory problems, they're having difficulty breathing, those are the people who are going to be going to the hospital. And we need to keep it that limited so that the hospital can accommodate and address the people who need it.
So that brings up a follow-up question. For those who have scheduled doctor's visits of a relatively normal nature, or even dentist visits, should they be postponing those until this crisis has passed?
So the Mass Dental Society has already contacted all dentists and orthodontists, and all dentist offices and orthodonture offices are closed, and have been starting, I believe it was Monday of this week. Regular doctor's appointments, every doctor's office that I know have been calling their patients and switching to talking to them over the phone and canceling regular appointments so that they're open specifically only for sick patients.
Do we have any idea at this stage how long this is going to be going on?
This is unprecedented, at least for the past 100 years, unprecedented. So the federal and international epidemiologists are following. They are coming up with computer models to look at what has happened in other countries and are modeling what they think will happen. But that's only what we think will happen. There's really no way. Clearly, the number of cases are going to go up before we're not at the peak. And we will be getting a lot more positives because we're going to be doing a lot more testing. That doesn't mean a lot more people are going to be visibly ill. It will mean that they're testing positive. Because remember, 80% of the people who test positive are not going to be sick. They're going to have the virus, but they're not going to be sick. And of those people who are sick, a very small group of those are going to be really sick. So those numbers are going to go up because we're going to be testing more and more. We know that's going to happen. So when you hear about flattening the curve, I know that's been bandied around a lot. What we're talking about is spreading out the cases so that they're not all at the same time and overwhelm our healthcare system. Even if we have the same number of cases, but they're spread out over time, our healthcare system will be able to deal with it and accommodate it better than slamming it all together in one small. And that's what they're talking about when you hear about flattening the curve, spreading the cases out.
Tom, from an emergency management point of view, where are we at?
I think the town is in pretty good shape. We had, from the first week of February, we decided that we had a serious issue on our hands. So we had already met. We had numerous meetings, the heads of the departments, Mr. Mayo, Ruth, and we mapped out a strategy. Every city and town is supposed to have what they call COOP plans, continuity of operations. We sat down, revised what we had, met with everybody, informed all department heads, got back what we call orders of succession, delegation of authority, so that who's going to be, because on this type of thing, this is a unique thing, maybe we're missing 30% of our workforce or 40%, so that means heads of our government are going to be out at some point. Who's going to be running the show in these different departments? Because no matter what happens, we still have to have law enforcement, fire, DPW to make sure our water and stuff goes through, payroll, those type of things, and naturally our infectious disease management. So those have to run no matter what. So we have to make sure that all those people know what their duties are and the delegation of authority. As maybe one falls off, the next person goes up. I feel very confident that we all have put enough time in and effort, and our plans are well thought out. The police and fire, who are our main source, because they're out in it every day, they've come up, they have revised, they've just come out with some plans the other day just to adapt to the new levels. And if we get to another situation, we'll adapt again. But it's ever-changing because of all the news we get. But I'm very confident that the town is in very good shape, and all the department heads know what to do. We have some great people here. I mean, no question about it, spread out over the whole town. So, and everybody knows what they have to do. So in that case, I feel very confident that we'll be in good shape.
And the fact that we have the Code Red notification system in town has helped quite a bit, too.
Yes, well, part of the thing is, with all this, is making sure that communication goes out. Our communications manager, Jim McDonald, does a fantastic job in getting the message out to the populace. So that's part of our function every day, is make sure what new message has to get out there, and she gets it out. She drafts it up, and within the day, all that new material gets out there. So now we can then act, and people can act and react to what she has. And that's a critical part of our function right now, making sure that everybody has the message.
Steve, one of the things that obviously has changed here, and I'm going to direct this to you as town administrator, although Ed will probably jump in on it too. This is also affecting, or could potentially affect, things like town election next month, town meeting the following month. What are we looking at from that point of view, and what are the changes that may have to happen, and what will they do as per affecting the town's ability to continue forward?
Well, there's a couple of things that will happen. Number one is that we are trying to make sure that we're ready for town meeting when it happens. So, and I think that the chair will talk a little bit about what we're doing with our meetings to make sure that that goes forward and keep people safe. But Wakefield, like every other town, is affected by this. So let's talk about the town election. We have a town election scheduled for, I believe it's April 28th, if I'm not mistaken. Kind of too soon to call right now what could happen, but in the old days, we would actually have to see a judge. Every town would have to go see a judge, and city too, that we need to move our election because of the coronavirus or what's happening. And the real concern is the social distancing that we have to keep.
Right.
And most of our poll workers are in that very vulnerable category.
Right.
So we'd have to have people to run the election. So in the old days, we need a judge to do that. And actually, Wakefield did that once when there was a blizzard scheduled for, I think it was 20 years ago, for an election. So we can't do that on our own. So there is legislation being bantied around and probably filed and that will be voted on at the state level to allow towns at a vote of the town council to move the election that any election that occurs between now and I believe it's April 30th, so we'd fall into that, to move it to somewhere between now and June 30th, with some caveats about how many days. We're not there yet, but I can imagine that at our town council meeting, I think we'll discuss it at our next council meeting openly and probably look at it at another one in mid-April. So we'll see where that one goes. As far as town meeting is concerned, with consultation with the emergency management director and the health agent, the moderator can actually move town meeting to another date certain and place certain. So that's also legislation that's been filed and has been part of the order of the governor's filed that, and the legislature is talking about it. So that's where we are with those two issues.
But depending on how long this situation continues, because town meeting is so close to the end of the fiscal
Right.
year, and the budget for the next fiscal year, which begins on July 1st, has to be voted. What's
Well,
the contingency
yeah,
if we don't make that?
Well, there's a couple of things that the governor creating a state of emergency and the town council jumping on and creating our state of emergency would allow us to do some deficit spending in this year. I don't anticipate that happening. However, for next year, next fiscal year, which starts July 1, if for some reason we were not able to vote and create a budget, we would actually work on a 1/12 level. So 1/12 of this year, we would actually be able to go and do, so 1/12 of our budget this year we could spend in July, 1/12 we could spend in August, of our budget for this year, at least 1/12. That's a big discussion with the Mass Municipal Association and the governor. I think I'm on a lot of conference calls, not as much as Ruth, but I'm on a lot of them. On this area, that is something that is evolving. But there is a mechanism in place to do this now. The State Division of Local Services is on it. Secretary Cronin has been talking to us about it. So that is evolving, and there is some things that we can do there. But it would be, worst comes to worst, we would go with the 1/12 budget, which is problematic with, salaries are going up and some costs are going up, so we'd have to do some juggling
By contract.
by contract.
Yeah. Ed, you have quite a bit that's also very timely, that's happened in the last few hours, or since last night. You want to talk a little bit about what the town is doing at this stage?
Certainly, David. Thank you for having me. Part of what the town is doing is trying to be proactive throughout this entire situation. And as you've heard from this team, and it really is a team approach, the town from the get-go has been trying to be ahead of the curve in every way. And I credit our town councilor, our town administrator, Mr. Mayo, and our Director of Emergency Operations, Director Walsh, as well as our health agent, Clay, for really just assembling this team that has had the forethought to make sure that we're doing things we need to be doing and doing them as soon as we can. From the town council side, I convened a meeting this morning of the town council, an emergency meeting, so that we could vote on an emergency declaration. And that does not mean that things are going to change dramatically here in Wakefield. But what it does mean is, in light of where we are today, given the trajectory of where we're going likely with this before we hit its peak, we want to be sure that we're doing everything as proactively and as prudently as we can to make sure that we are well positioned. And there is a good amount of discussion in terms of what declaring a state of emergency will ultimately mean. But there are indications that could have a potential impact on funding and reimbursements going forward after this situation passes. It may better position us potentially for support or supplies, say from the state or perhaps from the federal government. We don't know, but it puts us in a better position for that. A number of other communities, I believe, will be taking our lead on this. You've seen some of the bigger cities and mayors of those cities already make such declarations, but I would say we're probably in the minority of, I think, towns so far, Steve, although a number of them are down.
I would agree, and a lot of them on the MMA chat line are saying they've scheduled their meetings, they're going
Right.
forward, kind of for the same reasons we are.
Right. So
From Chatham to Amherst, they're going all over the state.
So that's something that presented as an important next step for us as a town. And then there are some practical things that we're doing from the town council side of things to make sure that we can continue to have the operations of government going forward, but in a safe and responsible way. First and foremost, maintaining the safety and security of all the residents of Wakefield is our top priority, and that's across the board. So how do we position that along with making sure that we're doing the things to keep government working and to keep things going forward? And as you mentioned, we're in budget season now. We have a fiscal year beginning July 1 as scheduled. So the town council is moving forward with our next scheduled meeting, which will be this coming Monday. But it'll be modified. We are encouraging all members to participate by telephone conference. We have had the technology here set up for that to happen. Any presenters are also encouraged to similarly participate by phone at this point. Presentations and slides will be available to all the viewers either on WCIT Live or live streaming on Facebook or watching it after on demand on Facebook. So there's that opportunity still to make sure that you can see your government at work, albeit in a somewhat different form. In addition, the public will not be permitted into the meetings for the simple fact that we have this social distancing in place, and it's for everyone's health and safety. However, we are still offering ways that the public can engage and participate in government. And as you know, David, at the beginning of our town council meetings, we always have public engagement where a resident can raise any issue. We're still having that. But instead of it being live, we're asking everyone to go onto our town's website And to Director Walsh's point, we've done a great job with the help of Jen McDonald to have a really robust communication strategy here. If you go into our website, the homepage, there's a box for coronavirus updates. In the news feed, you see almost every day there's new information that's posted. The coronavirus box, if you click on that, you'll have all the details. What just came out this afternoon were some of the new protocols relative to how the community can participate. So there's a link there online, so you can submit any concerns or comments that you have. They'll be read at the beginning of the town council meeting. And that same approach is going to be followed for all of the other commissions, committees, and boards that the town council appoints. We're encouraging any of those bodies, if it's not essential to meet, that they consider perhaps rescheduling or postponing. For those where it is more of a necessity, we're encouraging that it be convened telephonically through a telephone conference, and we've had good success with that thus far. And in the same way that we can have public participation at the town council meetings through our website, you can have that through the same portal on the website. Anyone can offer any concerns or comments that they have to any of the bodies, any of the meetings. Open meeting laws will continue to apply in that all agendas will be posted, as they normally would be. And we understand in these times it's important to keep people informed, and that's what we're looking to do. So across the board, it's important from the town council perspective and from the town perspective that we're doing that. And I think we're doing a very effective job at that. You know, it's times of crisis that I think really test leaders, and I've been incredibly impressed with the leadership team that we've assembled here on the town side. My colleagues certainly, and all the department heads, Mr. Mayo, the directors we have here today. Really impressive stuff.
What are some of the specific things that town council is going to be putting in place over the next few days? We're recording this on the 18th of March.
Sure.
So going forward from the 18th, what can townspeople look forward to?
Well, I think the biggest issue is the change in the way that we're operating government, and that goes from the executive decision of Mr. Mayo to close down town hall to the public, and instead have basic virtual experience with town hall. You can go online to do things like pay bills, your excise tax or other things. You can request in the Hot Street permit from on the website. We also have a Dropbox, a secure Dropboxes at Town Hall, so you can drop off, say, payments, or if you have written comments, if you don't have access, say, to the internet or aren't comfortable being online submitting a question, you can submit them in writing as well. That's all been detailed. I think the communication strategy will continue to be pushed out as warranted, as you've heard many times that these are unprecedented times, so there's not a real clear playbook in terms of how to go forward, but we know that the most important thing we can do as a community is push out information, and that's really what we're looking to do.
And, you know, with the support of Chairman Dombrowski and the rest of the council, we did some early things before we closed the library. We have a somewhat varied population that goes there to the public, but a older population that is at risk. Senior center, the same thing. Although certain aspects will continue, we're still, Meals on Wheels is continuing. We're still available there for moral support and talk and for driving to appointments. But you asked a question earlier about what doctors are doing. I'll tell you this week, in keeping with our director of the Council of Aging, Judy Luciano, one day they had 15, rides scheduled for people to go to appointments and what have you. Right. 14 of them were canceled by the doctor, so only one needed a ride. So you can see that all happening. We closed the Civic Center. Great asset to the town. We just got the new floor that the council supported, and now it's closed. And I know all the pickleball people are mad at me, but we didn't have a choice on that. Town hall closed, the public talked about. We do have a bin out front that has slots in it, so you could even drop off an application for redoing your kitchen if you're doing that. But we have our staff available. That we had a older person that had their heating system go today, and yet our staff is available to go and issue the permit to make sure this happens. So people are manning phones and what have you. So those are things that we're doing there, and we are, as much as we can, keeping our staff, police, fire, are a little bit more difficult in what they do, but keeping our staff apart, social distancing. So if you have a department that's a little bit larger, this person is not going to be there at the same time this person is there, so they keep that social distance. What I'm finding with my employees is that they don't want to go. They want to be there to help, and they're unbelievable. And I know that Ruth is finding it, Tom is finding it. It's go home, work from home. No, but you might need me here. And no, this person in my department has kids, or they take care of an elderly parent. Let them go. I'll come in. So it really is amazing how they're stepping up to the plate. And I'll tell you that the public has been amazing too. The public has been really well, and the emails that they send are very supportive. They do ask questions. They're worried about things, but they are very supportive. And one of our protocols that Tom talked about, and I say to the public, you are wonderful. But one of our protocols at the police and the public safety building, mainly because they tend to get food dropped off, is that we're not going to take any outside food. We can't, because we don't know, God forbid, if something, if someone was contaminated. So please don't get any, don't be disappointed by that. Don't be insulted by that. This is for the safety of our people. So I got to say, the public has been great. If I can say a couple more things, and I'm sure that, I'll open up. I hate to monopolize this show, but it is mine, so I get to do it, right?
Only half yours.
Only half mine. I really want to implore the public out there is that it's a nice day today, and I've talked a lot with Ruth about this on a health standpoint. Beautiful day today. Take a walk. You need to get outside, but do not, please do not, because we are going to have to make a decision on this. Do not take your children to the playground to play on the swings and the slides and what have you, because first of all, the kids aren't social distancing. You're not social distancing from the children or other parents. I know that's going on. We don't know how long this virus lives on plastic and things like that. But we do know that it's at least as long as that kid went on the slide before yours did that he was in line with. So I'm saying, please, we're going to have to take some steps there that I believe that other communities have. Take a walk, run around in the park. Those things are fine with social distancing. But the NBA canceled their season. That doesn't mean that all our high school kids in college should be down playing basketball now. So I'm imploring you to do the right thing, to be smart, so we can go shorter in this.
Well, and as Ruth alluded to early in the program, it's been a long time since the world has seen anything like this, 1918 Spanish flu. And, yes, medical technology has come a very, very long way in that 100 years, but the other mechanisms that are necessary to deal with pandemics just don't exist. And we're making it up as we go along. So as a town, it sounds like we're moving ahead well. In fact, there were a couple of things, and actually I'll let Ruth talk about them. Effective 12:01 a.m. Friday the 20th, there are going to be some changes. Can you talk about some of those?
Sure. So the Board of Health met last night, having an emergency meeting, and they voted unanimously on a declaration of public health emergency, similar to what the town's declaration of emergency. It just gives the town more leeway to do things in a quicker manner. And then they also passed an emergency order, which does eliminate the personal care services businesses in Wakefield starting Friday. So they're open today, they're open Thursday, they'll be closed on Friday. These are places like nail salons, hair salons, permanent makeup, massage, body work. Those will all be closed effective on Friday until such time that the Board of Health decides that it lifts the public health emergency.
When you say body work, you mean tattoos and that sort of thing? Or is
Yep,
there a
that
broader
includes-
definition?
Well, there's things like Asian bodywork, shiatsu, things that people think of traditionally as massage. Massage is technically regulated by the state, and a lot of other modalities are regulated by the Board of Health. So all of those other modalities will be closed. But that does also include tattoo, piercing, permanent makeup. We have a lot now of permanent makeup, eyelash extensions. It's a lot of new services out there.
So all of that will be closed as of 12:01 Friday morning.
Right, and our staff has been calling every business that we can find on the web to let them know, over the telephone, offer them copies of the emergency declaration and the emergency order, both of which are on the town's website.
And that comes in following up on basically closing the restaurants to sit-down meals. It's takeout only at this
Right,
time,
it's takeout
right?
and delivery only. That was done through an emergency order of the governor. So that wasn't necessary to be done on a local basis, and we really are encouraging the governor to do as many things as possible on a statewide basis so that it's not confusing to the public and it doesn't put one type of business at advantage to another business, whether they're in Melrose or Wakefield or Reading or Linfield. So,
One of the things that came up over the weekend, and I'll address it first to Ruth, possibly Tom, you might want to, and Ed also. One of the things that went through the public over the weekend was the idea of shelter in place, enforced shelter in place. What do we think we're looking at this stage toward that? Are we looking at that? And if it should happen, what does that mean to the townspeople?
so we're looking at all options, and we are always looking at all options. We try to take a measured response based on where we're at. So where we're at now is vastly different than we were in February and also different than where we were in January. So there are some counties and communities in other parts of the country that have instituted shelter in place. That can be done through an emergency order of the Board of Health. It's not under consideration at this point. It would be under consideration if there was widespread disease or threat of disease in the community. Sheltering in place means that everybody stays at home unless they need to go out for groceries or medicine, those kinds of supplies. And that would eliminate everything else. So you would stay home, you would not be out at a playground, you would not be taking a walk or a run. People would really be home.
Ed, you had mentioned earlier that before we went on the air that there are some other things that town council is doing to town-wide. And one of those is to encourage people to work on their lawns and go to the pit.
That's right, yes. In fact, it was an idea that had come up from a couple of nice days we had recently, and a resident had reached out to me. And the pit opens officially April 4th. And she and her husband were able to be very aggressive in filling a lot of bags full of leaves and other, spring yard materials. And so she had inquired as to whether that's something that we could think about as a town. And I think so much of what we're talking about now, and so much of what we hear about in the news is the doom and gloom of this. And certainly there's reason to be concerned, but there's not reason for panic. And I think that's where the distinction is. So when we're able to have forums like this where the community can hear and hear from us, the town leaders, that we're going to be okay. We have to take some appropriate steps to make sure that we're maintaining health and safety of everyone. I think Ruth has done a great job of explaining a lot of those initiatives that are underway. But we also have to be mindful of what things we can be doing for the community so that when the community is in fact home, be it sheltering in place or just home because there's nowhere to go,
Right.
that we have options for them. So that's where a lot of the neighbor helping neighbor comes in. If you have an elderly neighbor, for example, that person may have been going to the senior center, for example. Now they're not able to do that. So the feelings of isolation, especially for our elderly population, can really ratchet up during these times. So I think it's important to be able to reach out by phone, give them a phone call. If you happen to be at the grocery store, be thinking about if you could pick up something for your neighbor and leave it on his or her doorstep. Things like that we can do neighbor to neighbor. Townwide, I was speaking with Mr. Mayo today, and we were able to work out through DPW that the Nahat Street pit will actually be open. And so we'll get that information out, but it'll give the opportunity, one, for folks on nicer days to be able to be out in their yards, be exercising, be doing those spring cleanups maybe a little bit earlier than expected, maybe on a Thursday afternoon, not expected. And then we'll push out what dates and times we'll be able to have that open before its official opening on the 4th of April. We'll also not be requiring any passes or permits to be able to use the facility. We only ask that you load up your vehicle, you go in, you unload your vehicle, you keep this at least 6 feet of social distancing, which we've heard about many times, and then you leave the facility so the next person can come in. And we'll make sure that that's regulated, certainly. But those are the sorts of things that we can do so that people don't feel as if they're trapped in their homes. They can be active. It's good for exercise. It takes you away from the constant coverage that you see 24/7 in all of the numbers, in the increased numbers. And Ruth would be the first to say, we're going to see the numbers go up. We know that, but that's anticipated. So we shouldn't be concerned or surprised when that happens. But just as they go up, if we take the appropriate measures to mitigate, we're going to be seeing them go down. And all of what we're talking about here is how we can start to see them go down at a faster pace than we otherwise would. But I think it's really important as a town that we look at this holistically, not just about making sure that we are protecting the health and safety of everyone, which of course is our top priority, but also looking at ways that we can try to enhance the quality of life during a very difficult time for folks. So
Sure.
I think this is just one example of what we can do, and we're continuing to think about other ways that we can be helping the community. Something else I want to point out as well, and a lot of credit goes to Mr. Mayo on this. The town council and Mr. Mayo had created a town emergency fund. And this fund is basically contributions that have been made. It's not taxpayer dollars, but contributions that have been made that is available for residents who find themselves in a difficult financial position or situation. Someone can't make a rent payment because of some sort of extenuating circumstance or whatever the circumstances may be. And it's we're very respectful of everyone's privacy, certainly. And it's a program that we've seen some good success with. And Mr. Mayo can speak to some of the really positive stories that have come out of that. This is a time for us to focus on ways to help each other. And the emergency fund is one such way of doing that. We're currently in the process of creating a portal so that through our town's website, people can make a donation online into that fund. Right now, until that is up and running, anyone can send a check right to Town Hall. Either you can mail it, you can drop it in one of the secure boxes we've talked about in front of Town Hall. And that will go right into the fund. And we've already begun to see requests going in. The town, we'll be talking about this more at the town council meeting on Monday night. But it's a really good opportunity for us to be helping those in need. And certainly these are difficult times for everyone. There are not just health stresses, but also financial stresses that come along with this, especially
Right.
for a lot of our community who might be hourly workers, for
Right.
example.
Or
So-
with businesses closing.
Absolutely.
Yeah.
Indeed. So that's another way that we're trying to look at this in a positive way to figure out what we can do to, again, proactively and constructively have a positive impact during an otherwise, unfortunate time that we're all going through together.
Have we had, Steve, any indication that, for instance, with businesses being forced to close for health reasons, that the town is working with landlords, for instance, to help out there?
Not-
Because that's going to,
Not so much landlords, but I will tell you, we've received a lot of information from the Small Business Administration and from the Massachusetts Business Development Council, and those have all been pushed out to the website and to the and through the Chamber of Commerce. And I think that landlords have to pay their mortgages too. So there's that dynamic there. But and there's a lot of talk about some packages down on Beacon Hill for this too. So I get all those updates, and those things are being worked out. So we are looking and trying to share that information with everybody that we can. But I would say this, that if you are going out as the public, I know that the restaurants are closed, and we have a lot of restaurants downtown.
Right.
Buying a gift card now, getting takeout, buying a gift card is a great way to help them out. And you can enjoy a dinner later. I was going to say, with all the work that these two fine employees have done, I would take them to dinner, so we'll have to wait. We'll get a rate check, right? Go someplace nice.
So, Ruth, any last thoughts?
Nope, we're available. We have somebody in the office during regular business hours, either myself or the public health nurse, so that we are here to answer any questions anybody has. 781-246-6375 is a direct line to the health department.
Tom?
The food pantry is still open.
Okay.
So I want to make sure people are aware of that.
So that's the one thing at the Civic Center that people
is open,
can,
yeah.
Right.
Yeah,
can take advantage of if they need it.
Yes.
right, and I think
Absolutely.
we would do everything in our power too. If things got worse, that would make sure that that was still up and operating, because then people would really, we wouldn't see anybody where they weren't had the ability to eat. So I think we would probably put a lot of effort into that through our town and through the state as well, so.
Ed?
I think that, David, there are probably two things I'd want to make sure that all residents realize. One is we're already thinking 5 steps ahead. I was speaking with Mr. Mayo this morning about some contingency plans if we have X, Y, or Z scenario. Hopefully, we'll never get there. But if we do find that this continues to progress, we know what the next steps are that we need to take as a community, as a town, through leadership to make sure that we're there and we're ahead of things for everyone. So I think everyone can rest assured knowing that we as a community are on top of it. We know what to expect next, and we're prepared. And I also want to make certain that everyone understands some of the different protocols that we have in place now, police and fire specifically. And I'll focus on police. I spoke with Chief Square this morning on this. They're doing a lot of, they've changed the way that they're operating to try to make sure that they mitigate and minimize risks. So they have different shifts that are on, and those shifts they try to keep very, very consistent so that you don't have crossover between shifts. That's one way of doing it. They have some great procedures in terms of disinfecting vehicles that start and end of shift. But from the public perspective, when you call the police, if it's not 911 call where it's clear that you need to have assistance immediately, you're probably going to be asked a few more questions, and that's intentional. Mm-hmm. And so I would ask the community to understand that that's going to happen, because they want to feel things out to make sure that the officers arriving at your home or the fire department arriving at your home is safe. And so if there are additional precautions that they need to take, they want to know that in advance. Mm-hmm. In addition, when police come to your home for a call, they'll likely ask you to step outside. So don't be surprised or unnerved by that. It's another part of their enhanced safety protocol. Bringing police officers into a home increases the risk, that they may in fact, end up being exposed to COVID-19, which could then, create problems for our department, which we don't want to have. So I know that the police have had some issues, with that, and people having a little bit of hesitation and wanting to step out and speak. That's just going to be a standard operating procedure for the next short while. Right. So I think it's important that everyone be aware of that, and we also have to be mindful too that our police are facing rather uncharted waters too, in terms of this is not a snow day. Right. So people are being home. Alcohol consumption is certainly an issue. We want to make sure that domestic, issues, are not on the rise. Mm-hmm. So we ask people to be mindful of that. The idea of getting outside in your yard when you can, the idea of social distancing out in the fresh air. Those sorts of things we can be doing. It's not a time to be trying to have play dates and bring in the whole neighborhood kid, all the neighborhood kids into your home. Right. As much as it seems like that would be something that would kind of keep everyone occupied, it's not the right thing to do. Again, this is not a snow day, and so we have to treat it differently. But you'll see our first responders responding differently. right down to DPW that has that's is staffing differently in order to try to make sure that we have those essential personnel in place long term, without any issues.
I'd just like to close. I can't thank the town employees enough for all the work that they've
No,
done.
they're doing a
It's been
fantastic
been a
job.
stressful time
Yeah.
for them. And Tom and Ruth, really, 24/7, you guys have been fabulous. I really appreciate all the work that you've done, and I know we're in a much better place because of Tom and Ruth and the town of Wakefield employees.
Well, and I would suggest also, Steve, normally we're a monthly series, but I would suggest if we see any major changes one way or the other, that we'll do a follow-up show
Yeah,
and
absolutely.
bring everyone back and keep everyone informed as much as possible in as timely a way as possible. And if anyone has any questions about what's going on with the town and town officials, please feel free to email, telephone, put a note in one of the boxes at town hall or whatever.
Call, yeah.
But, just, and keep your good sense of humor.
Yeah, and I do
know.
think we should thank WCAT. This is a very valued service for the community. Not everybody is going to go on the town website, not everybody has Facebook.
Right.
Most everybody has a television.
Right,
And most everybody has, has access to cable TV, so.
right.
I would
Plus,
hope
this is
that
available on
right.
YouTube.
And it's available on
yes,
YouTube for that. So I would
yes.
just hope that it's a great service for the community, and I thank you for hosting this today as well.
And I thank you for joining us. Feel free to send your questions, concerns, and as I say, if we find some changes along the way, we'll certainly do a follow-up show before our next scheduled show. Thank you for joining us. See you next time.